Welcome back to my short after a great conversation with Elizabeth Kipp. So, one of the things that became very clear is that trauma based pain therapy is very, very valuable. There are many people who think that they have access to it, and many different doctors actually think that using medications is the best way. But it's clear that medications often cause symptoms to get worse, or sometimes clearly do not make things better. What Elizabeth has going for her is multiple different modalities that she has worked out, including trauma based yoga and also multiple different modalities that have her really looking at um, healing people through their trauma and through their chronic pain. And she's become a massive expert at it. Now, how does this interface with most of our therapies? One of the things that's very clear is that most of us conventionally trained doctors, nurses, and therapists don't really have great access to managing chronic pain. The best that we actually have is to support the intention to keep it from getting worse. But in reality, it's not only doesn't make it get worse, it often doesn't work at all. So, the way through chronic pain, using tools to reclaim your healing power, is something that Elizabeth brought to the forefront. She has had a life that was packed in many ways with having to deal with her own trauma and pain, and her own history actually informed the therapies that she then latched onto and now is a proficient clinician in providing to her clients. She's able to meet people at one-to-one and in group settings, both on the phone and also online, and also meets people live in one-to-one and group settings. She has a long history of studying multiple different modalities, including those in the sciences, and that clearly informs how detail-oriented she is. She also has the near-death experiences in her life where she was able to see life from a different dimension over and above the ego. One of the things about most of the healers that I have spoken to on my podcast is that they have a capacity to see life beyond that which they've been taught inside of the conventional training. Elizabeth has a diverse background that includes plant sciences, agriculture, ecology, environmental studies, and even remote sensing. She utilizes all these skills when she comes through as a recovery coach and sees herself not as a therapist and not as a doctor, but as a coach, someone who can really help people who have wanted to get the help and who have sought help and maybe aren't getting the actual bona fide um, extraordinary help that is available when you utilize some of the modalities that she's now proficient in. She's able to help people stop taking harmful pain drugs and, in fact, has been able to facilitate freedom from those who suffer from pain. I love Elizabeth's way of looking at pain, which is any pain, physical, emotional, or spiritual, that is felt for 15 days out of 30 for 3 months or more. And it can be healed in multiple different modalities, including yoga and also ancestral clearing, which we talked about briefly on the podcast. The idea being that ancestral clearing is a cousin of constellation that allows us to take into consideration the manifestations that entered us through our arrival here on Earth, through our ancestors and their experiences in life. Elizabeth really had me looking at all the many ways that life can be observed, including sort of the limiting way of looking at life through our ego-based thinking and the expansive way of looking at life through the awareness-based thinking. It was a deep pleasure to interview her, and I hope you enjoyed it as much as I did in my conversation with her. We went really far down some of the holes, looking at how recovery actually takes place. And Elizabeth was able to really discuss some of the things that she does or she thinks or she becomes when she's assisting people from the suffering of being chronic pain sufferers. I really appreciated being with Elizabeth, and I love this topic of healing pain without medication and not using conventional methodology. So I hope you did too. And I invite you to listen back to the podcast to get more informed and detailed instruction that Elizabeth was able to bring forth during our conversation. Thank you so much for being a listener of The Healthy Healer. It's been a deep honor to be the host for you. And if you like this podcast, please comment, like, or share the Healthy Healer podcast with other people, as this allows us to get out to the ears that are most in need of hearing it. Thank you again. And it's Dr. Fred signing off. Catch you on the flip side. Bye for now.